So today I want to talk about the forearm muscles. Now when you look at the muscles in the forearm, there's going to be a lot of names, very long names. Extensor digitorum communis, flexor digitorum superficialis, extensor carpi radialis longus, extensor carpi radialis brevis, so on and so forth. But I don't want you to get caught up in the names because, the names mean something, all right? The names tell you exactly what the muscle's doing, where it's going, okay? Now, the first thing I want to bring you to is when you look at the muscles in the forearm, basically what we're dealing with is we're dealing with a flexor compartment and an extensor compartment on the posterior aspect of the forearm, right? The flexor compartment is going to be doing the flexion of the digits, right, which is this motion here, and then the extensor compartment posteriorly is going to be doing the extension of these digits, okay? In addition to moving the digits, the fingers and the thumb, it will also be moving the wrist, okay? It will also be moving the wrist. Now notice that I can move my wrist essentially in four different directions, four main directions, right? I can flex my wrist, okay? Flex my wrist. I can extend my wrist. I can also move my wrist in a medial direction towards my ulna. This is known as ulnar deviation as well, okay? And then I can move it in the lateral direction, right? Or abducting it. This is also known as radial deviation because my hand is moving towards my radius, okay? So there's these movements of the hand at the wrist, and then there's also the movements of the digits, right, that we're going to be looking at. And also we can't forget that there's going to be muscles that are dedicated strictly for the thumb. Anything that has the name pollicis in it. Pollex refers to the thumb, okay? Now, those are the two main compartments, flexor compartment and extensor compartment. And when you're looking at these muscles, most of them are going to be originating at the epicondyles of the humerus, okay? They're going to be originating at the epicondyles of the humerus. And what you'll see is that the flexors, most of the flexors are going to be originating from the medial epicondyle of the humerus, and then the extensors will be originating from the lateral epicondyle of the humerus, okay? So this means, if they're attaching to the humerus, this means that these muscles are crossing the elbow joint. Therefore, they will exert some sort of force across the elbow. Now, are they the main movers of the elbow? Absolutely not. The main movers of the elbow would be our biceps and our triceps brachii in the arm, okay? These forearm muscles, even though some of them do cross the elbow joint, their main function is going to be at the wrist or at the digits and the fingers and the thumb, okay? Now, before we don't want to just list all these names. I want to introduce a certain concept to you. So let's say, for example, we're looking at my left, I'm going to put my left hand, or I should say my left forearm, in cross section here, okay, lying in this supine position, right, on this board. That means that my radius is going to be out here on this side. So my radius is going to be out here on this side, right? And my ulna is going to be over here on this side, okay? So just for orientation purposes, this is my lateral side, this is medial, this is, we would call this anterior, and then this is posterior, okay? And this is my left forearm. You cut through it, you see the radius and the ulna over here, okay? Now, there are going to be, well, before I get there, let's imagine that this is a square, okay? Square has four corners to a box, okay? Now, four corners to a box over here. We're going to have a muscle tendon here, another one here, we're going to have one here, we're going to have one here, and we're going to have one here, right? Now these tendons that you see running here, they're eventually going to attach to the hand, right? At one of the metacarpals or the carpal bones, okay? And notice that these tendons are oriented at those four corners of this box, okay? So this muscle or set of muscles that we see right here, these two are going to be our extensor carpi radialis longus and brevis. Okay, there's two of them right here. This one right here is going to be oh no, that's not correct. So we're gonna have two tendons over here on this side and then one on this side. That's the correct way to do it, okay? Because this is gonna be our extensor carpi radialis longus and brevis, right? Which is on the extensor side, on the posterior side. And over here we're gonna have our extensor carpi ulnaris. This is gonna be our flexor carpi radialis, and this is gonna be our flexor carpi ulnaris, okay? 5 muscles that each are oriented to 4 corners of the box, okay? Now, you can see based on this already where these names come from, okay? Flexor carpi ulnaris and flexor carpi radialis are on the anterior or the flexor side, okay, of the forearm. So that's why they have the name flexor, okay? And then we see that radialis comes from the fact that the flexor carpi radialis tendon is running by the radius, right? It's on the radial side. Flexor carpi ulnaris is on the ulnar side. Same thing goes for the extensors, right? Extensors on the extensor side, radialis on the radial side, ulnaris on the ulnar side, okay? Now, if this muscle, let's say the flexor carpi radialis, were to contract by itself, okay? Were to contract by itself, which way is it gonna move my hand? Remember, this is a cross section of my forearm. These tendons are attaching to the hand, to the metacarpal and the carpal bones in the hand. So it's going to be pulling on the hand, right? And which way is it going to move the hand? Well, just think about physics. It's going to move the hand in this direction, okay? So that's going to look like this, right? It's going to move it up towards that corner. So that's a combination of both flexion, right, in this direction, and radial deviation. That's what the flexor carpi radialis would do, okay? Now what about the flexor carpi ulnaris? It's going to pull it in this direction, right? So that's going to look like this. It's lifting it up this way, okay? Now, let's say, for example, that the flexor carpi radialis and the flexor carpi ulnaris both contract at the same time. Well then, in that situation, we're going to have a synergistic effect that's going to produce a vector that's going to go directly in the anterior direction. And that is going to look like pure flexion, okay? Pure flexion of the hand at the wrist, all right? Now, same would go for extensor carpi ulnaris and extensor carpi radialis longus and brevis. If the 3 of them, right, contract at the same time, or maybe even just one of these 2, and this one, you're going to get pure extension at the wrist, okay? And if you have flexor carpi radialis and the extensor carpi radialis muscles both contracting at the same time, then you're going to get a pure radial deviation of the wrist, and it's going to move this way, okay? And this likewise goes for flexor carpi ulnaris and extensor carpi ulnaris. If they contract, you're going to have the hand moving in the medial direction, which is going to be ulnar deviation at the wrist, okay? And this is just a nice conceptual framework for what we're going to be dealing with when we're talking about these carpi muscles, right? So I told you the part of the name for flexor, what that means, the part of the name whether it's radialis or ulnaris and what that means, right? But what about the carpi? Carpi just means that it moves the wrist, the carpus, okay? Carpus is wrist, okay? That's the Latin name for wrist. And notice that I said that they attach to the metacarpals or the carpal bones. Okay, so these are muscles that their function is purely to move the hand at the wrist, and they will be attaching either to metacarpal bones, carpal bones, or both. Okay, good. And that's straightforward right there. The next ones are going to be now the digitorum muscles. Okay, and the digitorum muscles are a whole other thing.